staying with us. Let's bring you this now. There's been reports of people getting infected with COVID-19 this after receiving their very first jab. Now, how soon does one get protected after being vaccinated? To talk to us about the fears, the myths, as well as facts about the vaccine is the South African Medical Association chairperson, Dr. Angelique Coetzee, who joins us now live. Doc, thank you for your time. Good morning to you. I mean, I'm sure we've had this conversation before, heard it in reports, but it's important to keep reiterating it so that to sort of manage expectations here of the vaccine. First things first, can you get reinfected or infected with COVID-19 after getting your jab, and why is that so, if you can?
Good morning, and the simple answer is yes, yes, yes. And I think we need to get this out to the public out there. So what is important to understand, if you get your Pfizer or your Johnson & Johnson vaccine, it takes about 28 to 30 days for your immune system to really start to kick in. For Johnson & Johnson, it's easy. We know that after 30 days, you are supposed to be protected against severe disease, but you can still get mild COVID. For Pfizer, important to understand, about 30 days, anything after 2 weeks, that your immune system actually starting to produce antibodies. But after 30 days, a bit better. But only after your second jab, about 2 weeks after that, you will get the most immunity or protection from that vaccine. So what does it mean for the average person out there?
Right.
It means...
Yes, please continue.
It means I'm going today for my Pfizer vaccine. I've got a bit of a running nose and a bit of a sore throat, but I don't feel sick, so I'm going for my jab. The problem is 2 days or 3 days later, you're not really feeling well and decide to go and see the doctor. We then make the diagnosis of COVID-19. Because that snuffles that you had when you were standing in the queue was most probably already COVID, or 2 days before you start with symptoms, you can already have COVID-19 underlying. And you go for your jab. But expecting that you would be fine. You will not be fine. The jab is not going to help you because it takes its time to, as I've said, about 30 days. But the other thing that is of concern to us is that while you're standing in the queue and there is not good ventilation, 1.5 meters, the old story is not being adhered to, you can get COVID-19 from someone else who doesn't adhere to the regulations. And then you get your jab and then think it's the jab that's not working. You're right, the jab is not working the first 30 days. Please, we need to stress this.
It's important to get this information out, Doc, so there aren't any, myths and misconceptions. And I'm glad that we got that out of the way, that you need to wait at least 30 days for, the vaccine to, of course, do its work. Now, getting into any potential complications due to the vaccine. Now, is that a possibility?
Again, with Pfizer, there's no documented data that Pfizer give any blood clots. So, and what we have seen currently with the Pfizer is, again, more or less the same than with Johnson & Johnson, sore throat, a bit of body aches and pains. And again, that is also that people think it's a side effect of the jab, and then you already have COVID underlying. So please, that can be symptoms of COVID as well after you have taken your jab, mistakenly think it is the side effects. And it's important in the elderly people because those are the people that's vulnerable with the comorbidities. Those are the people that we actually try to protect. And again, if you do not adhere to the normal measurements that we keep on asking, and if you get to a site and there's a long queue, go back home. Don't stand in that long queue. You can rather go back for your jab after you, at a different time, arrange with the people at that site and go back at a different time. Also important, if your family that you are in close contact are suffering from COVID-19, please wait at least 2 to 3 weeks before you go for your jab to make sure that you don't have it underlying. It's a huge problem that we are currently seeing. We are making diagnosis on people, and it's not a once-off. It's not someone that went to a party afterwards. This is elderly people we're talking about. It's people that really try to protect themselves but doesn't understand that for 30 days you still are vulnerable of getting the disease.
Doc, I'm going to let you go in just a few minutes, but just briefly, please, if you may, how are you tracking the adverse reactions, to vaccines in the country? Do you have perhaps, a number, data, statistics, just in terms of how we're faring as a country in terms of reactions to the Pfizer vaccine?
So SAPRA has got an app that they are using, and where you are supposed to notify them if you think you've got an adverse reaction, and they collect the data. So when you get your immunization, they're supposed to give you that number or the website where you can then report your reaction. So it is out there. Whether people make use of it, that's a different question.
All right, well, we'll leave it there. Thank you so much, Dr. Angelique Coetzee, chairperson of the South African Medical Association, talking to us this very morning. Now, on the